everyone. Thank you so much for joining this session on generating SOAP notes with AI to enhance clinical documentation efficiency. In this session, we'll give you a showcase of John Snow Labs medical LLMs and how we can use them to automate healthcare admin tasks. So to give you a little bit about myself, I'm Bo. I'm a partner solutions architect at Amazon Web Services, and I'm joined here today with Shubhanshu.
Hi, I'm Shivanshu. I'm part of the JSL team. I'm a solutions architect at John Snow Labs as well.
Great. And to give you a brief overview of the agenda that we will be covering in this session. So first, we'll give you an introduction to what is SOAP, some of the manual overhead and the challenges of SOAP currently. And then we'll dive into the solution that we have developed and give you a brief demo of what it will look like. And then lastly, I will talk about the implementation and scalability of the solution. And then we will close it and have a Q&A session at the end. So to give you a brief introduction into SOAP, SOAP notes are a standardized method of documentation used by healthcare providers to record patient encounters. So the acronym SOAP stands for subjective. So this relates to the client's feelings and self-reports. Objective, which is the reported findings from a practitioner. The assessment is how the client did or responded during treatment, and the plan. So what is intended to do next time to address future care, such as next steps or overall recommendations. And this method of SOAP notes was developed by Dr. Lawrence Weed in 1968 as part of the problem-oriented medical record system to bring structure to clinical documentation. And this also acts as a common language across healthcare teams, which allows doctors, nurses, therapists, and specialists to seamlessly share and interpret patient data. And lastly, SOAP notes serve as an essential legal document, providing a clear timeline of care for patients, which is crucial in malpractice claims or insurance audits. And now I'll have Shubhanshu talk about some of the manual overhead of creating these SOAP notes and about the solution that we have developed.
Thanks a lot for that. So when we discuss SOAP notes, it's not something that we usually associate when we go ahead and when we discuss treating of patients, because this is something that's usually worked on by healthcare administrative as opposed to healthcare professionals working in care. Doctors are going to create notes, but they're not going to spend a lot of time creating the formal forms needed to keep track of documentation and also work with regards to prescriptions and other facets that you have to work with. You see, these SOAP notes are not just a one-time tracker. If you have repeated visits to a particular physician, that's something that's going to come up in SOAP notes as well. And that's how patients, nurses, doctors are going to keep track and have a communication language between all of them. While it's pretty efficient in terms of getting the message across, it's pretty inefficient in keeping track of this. As you can imagine, a doctor's notes are going to be a little unstructured, and in many cases, you might not even have complete information between them. So it takes a lot of time for nurses and any kind of administrative people to actually create these notes and fill them up as required. Not to mention that it's going to take up a good amount of error correction method to make sure that these forms are valid. Malpractices have risen up to about 20% in the recent studies based on what we have researched. And these kind of precedents show that, yes, even though we have professionals who have a lot of experience, if you're creating 1,000 documents in a day, there's a good chance some of them might have errors. So yes, the time consumption and documentation errors lie as the biggest problems when it comes to manual effective deployment of SOAP notes as a whole. And then finally, there's an obvious aspect on the impact on patient care. As you can imagine, if you are someone who is at the end of today working on 1,000 documents per day, and that is a true number from a lot of statistics that we have worked on, you're going to have a burnout. I mean, burnout isn't exactly a new term in the healthcare industry, as a sad reality that we're trying to work against. However, this is a facet where we can actively work to make sure that burnout doesn't in fact affect any patient through the healthcare administrative that they're working on. So the impact on patient care, while burnout could be the most important aspect, it could also be a huge leeway if such tasks are taken away from healthcare administrators and they can focus on non-menial tasks in this case, which could be actually administrating the medicine and taking care of patients and working on the other supplement tasks which are provided to them. So these are the three which I have found when speaking to nurses and doctors. They are much more excited to have these solutions because, as you can imagine, these are not replacing the core beliefs of what manual and what automated solutions can work in, but significantly help reduce the overall time that they want to spend here. So that's a bit on the ineffectiveness of manual SOAP notes. Now let's take a look at how exactly we achieve this. And to do that, I'm going to build a picture towards AI agents because that's where exactly we are headed. Because what we want to do is, yes, we want to ensure that the SOAP notes are being automated, but that is just one facet of healthcare administration. If you're going to create something, let's create something that can be that can facilitate other facets of administration as well, that can automate other manual tasks which are menial for a lot of healthcare workers. But before that, let's take a look at a simple workflow. What have we worked with our simple MVP here? Well, the MVP that we have defined can take a look at or maybe work with transcripts or maybe the raw audio of a conversation between a doctor and a patient. This conversation is highly confidential in a lot of places, but not to worry. The JSL library already comes with annotators and transcription services, which can automatically censor these type of test cases if needed. However, on top of this, since we have integration with AWS, health imaging, and other services, we can maintain compliance even without any censorship or anonymization as and when needed. In JSL, we provide both options, and depending on your use case, be it patient tracking or anonymization for the sake of research, we provide libraries and functions for both. So that's the first step, getting the information that we would like to convert into the form, either way by an audio file or by a transcript. This information is going to be sent out to an AI agent, which is going to understand the task given to it, which is filling up SOAP forms as and when required. It's going to require the form. It's going to require some additional context here. If needed, a bit of manual intervention. Again, that's not always out of the picture. And what the healthcare administration should get back, say, as soon as a particular visit is done, is the fill form. Just think about it. You are going to a doctor, and as an HCA, you are keeping track of the exact discussions. And currently, you might have to either hear in or you have to work with the doctor's notes to create this form because that is the next task here. However, as soon as the conversation is done, within a couple of minutes, the form filled is ready for you. And that really shows the impact of what we would like to work in. And this impact actually is going to go much larger. So now the architecture diagram gets a bit more specific as to how exactly our solutions are going to bring in. Now, Bedrock is just an example here because you would like to work with an AI agent system as opposed to a singular LLM. That's why Bedrock is the use case here, but the same thing can be performed in SageMaker as well. The main thing I want to like to focus on is the fact that we would like to use an orchestration system. If you're going to go ahead with AI agents, we need to ensure that the agent in question can interact with other agents. In this example, we have two, say, sister agents in parallel against the orchestration model, primarily a Q&A model and a summarization model. So what are these? What exactly are we trying to achieve here? Where the orchestration model's requirement is to make sure to understand what exact context is provided to the agents and what exact task is provided to the agent. You see, the reason agentic AI is not as susceptible to hallucinations as LLMs or standard systems is because the agentic AI systems is recursive in nature. It's going to look at the results and then see what exactly it has to do. It has a quick round of quick analyzation, similar to how a human might just take a step back and see the entire problem statement before giving it off to another set of systems. And the next set of systems here is the summarization and QA model. This is where the JSL libraries shine because the models that the application comes with is not only just a standard LLM which is trained on the entire internet. No, the LLM that the JSL systems come with are trained specifically on medical papers, they are trained on doctors' notes, and a lot of assertions which is provided within the medical space itself. We are highly centralized and built towards the process of kind of refining LLMs to make sure even if you are an SLM, so which is a small language model, they are much more accurate than standard LLMs, as you might think with regards to competitors as GPT and others. In this example, the two models that you're working with have been derived for specific use cases. A Q&A model has been built to understand the context provided and try to answer as medically accurate as possible based on the context provided, as well as the knowledge base it has within the system itself. On the other side, there's a summarization model as well. A summarization model is built to define timelines to work with a larger context. This could be, say, hundreds of thousands of pages as well of patient history. And the summarization model can either build timelines, can provide appropriate summarizations, listing out allergies, and all the other facets that you have to work with. But it has been created to specialize with that. And that's the key aspect here. And that's where we understand why an orchestration model is needed. Depending on a type of form. So SOAP form here is just our starting ground, right? We want to make sure that we can hit other types of forms as well, and we can eventually work with different administrative use cases. That is why our use case here works with a multi-agent setup, and that's what we want to achieve with AI agents. We want to have an orchestration system, and we want to have specialist agents and specialist LLMs in conjunction with this orchestration model in communication with them so that it gets the best result out for the best use case. Apart from the agent itself, there's a good chunk that we have to work with because an agent is not going to work in isolation. Obviously, there's a connection that's needed with the healthcare administration. Now here, as you can imagine, this could be AWS Health Imaging. This could be a simple API. Here I've defined a Lambda function and other facets as well. But the basic gist here is that we want to define a connection between the two. And AWS here can do the heavy lifting at this point to make sure the connections are defined in a compliant way. Once the connections are defined, we also want to make sure that the agents have access to raw forms, to the raw data that they're working with. That's representative of the S3 bucket filled with forms. These are empty forms, so you don't even have to go through the process of maybe creating a specific form for them and filling it in. This is something that the application can quickly pick up either from specialized buckets or perhaps from the internet as well. A bucket is much more better here, as you can imagine, for standardization and other use cases. Then you will see that we also have connectivity with AWS Health Lake and S3 buckets. Health Lake, Health Imaging, and other services should also be interlinked with these sort of agents. The main use case here is that the higher amount of context is provided to an agent, the more accurate it's going to be. So in this example, I've gone ahead and make sure we connect to a DynamoDB, we connect to Health Lake, we connect to S3 buckets, fetch any kind of information that we're working with. This could be images, this could be notes, this could be patient data, and any other facet that you would like to work with. Once the AI agent has been provided the context, the task, the forms, and all the other facets, is going to recursively run, basically understand and create an output. Then, of course, check the output internally, see if there's a good match, decide if a rerun is required, if a manual intervention is required, or if the output is justified and valid, and then send the final output back. In this example here, it's going to be isolated on filled forms, but that's the basic gist alongside which this can be run at. In fact, we would like to use this kind of operations for multiple manual interventions. This could be for translation of summaries. This could be for translation of, say, highly medicalized text into more simple languages, because that's an example that has come forward as well, where people are not really sure what a particular medical text means, and they want to have simplified use cases. This could also be definitions in defining dosages and other aspects where patients would like to know exactly what they're consuming, what the dosage requires, and if there are, say, any issues that come in where they might have missed a particular dosage, or they would like to go ahead and say define if I want to finish up this course early, or any other question on that front, they can always have an agent to talk to as well. And this agent will understand what the corresponding patient history is, understand what forms have been given to them, and of course, try to work within that context. So that in a nutshell is the actual architecture. It's kind of complex in the sense that it can do a lot, but it also depends entirely on the type of agents, type of data, and type of workflows that you're trying to work with. The more services that are interlinked with this particular agent, the more versatile it can be. And of course, the more context you provide to this particular agent, the better it's going to be at providing the outputs as well. And one of the key aspects here is the possibility of using JSL medical LLMs. The main reason that we are pushing this as JSL and not using a standard GPT model is, of course, for the sake of additional anti-hallucination systems. At the end of the day, if you are a medical professional and if you have used GPT for any particular use case, and we have definitely tried it for our systems here, you'll notice that hallucination, assumptions, and a lot of other facets come into play very easily. These models, which are commercially defined as large language models trained primarily on the internet, are not built to handle the use cases which pertain to medical use cases, which is any kind of hospitalization use cases, any kind of pharmaceutical use cases, and other facets as well. This is why dedicated models built on this substructure are very important. And of course, integrating this with a proper platform like AWS always adds to the cause and helps the process, and in this case, the agent, work better. Now that we have done that, let's move on to the next facet, which is the actual demo showcase. So let's kind of minimize this particular screen. And as you can imagine, with any cooking show, we have actually run everything together. And I'd like to kind of illustrate what happens within our model itself. It's pretty straightforward and should not take a lot of time. What you see here is the actual model itself. Again, this is what we are working with. It's pretty straightforward. It's the same diagram that we were seeing earlier. And before we jump into it, there's a bit of setup that we would like to go ahead with. The setup particularly involves using SageMaker, installing SageMaker, other libraries, and other facets that we're working with. And of course, then defining our configuration to AWS. Since we're working with SageMaker, we would like to ensure that we have defined our keys and made sure that the user access level has been correctly deployed. We want to make sure that we can deploy models, they can communicate with these models, and of course, as and when needed, close the models as well, given that we are running some LLMs, be it real-time or batch-based. Once we've defined our AWS configuration, which could be as easy as uploading a credential file, you'll notice that we have to define an ARN. This ARN comes in wherever you are trying to define any kind of, say, subscription model that you would like to use. Again, for your specific use cases, if you're working with, say, a different deployed model in Bedrock, perhaps you don't have to go ahead with an ARM. At that point, the VM equivalent of Bedrock itself can have the VM loaded in, which is the LLM loaded into the system. That could be one use case. In our example, we're illustrating that if you're someone who is comfortable with just bare bones code, and you just want to connect to an LLM directly, there's an ARN which you can work with as well. This is provided when you subscribe to a particular system. And here you see we are working with both summarization and QA models as well. Then we initialize the system. Now, since I'm working with a real-time use case and I want to showcase this working live, in many cases, I have kind of switched this on. This might take 20 minutes as this is a real heavy VM trying to load up for the sake of demonstration. And there's nothing much to it. You just have to define what type of instances you would like to work with and what exact VM you'd like to use. And once that is done, it's pretty straightforward for our, say, MVP here. The three processes is to provide the doctor's notes. What exactly are you working with transcripts there? Then provide the actual form that you would like to work with. And then, of course, just download the filled form. With regards to doctor's notes, instead of providing a direct system, what we have done is that we are working with the MTS data source here. MTS is a very popular mainframe database that holds a lot of transcripts. And so for our use case, we have a good amount of these transcripts where, as you can see, there's a good amount of dialogue which the application comes with, where doctor and patients have a kind of dialogue between what exactly the patient is feeling, what the doctor has done, what the doctor recommends as potential next steps, any kind of patient history and other facets are also kept in track here. What we do here is, since we have a lot of records, we're going to focus on the largest amount of dialogue so as to kind of illustrate the point better. But the next step after that is, of course, just loading in the form. The input form looks a little like this. It's very similar to what our PPT was focusing in on, but this is what the input form basically works with. If the date is mentioned in the transcript, we can pull that. The LLM can provide it manually as well. The duration is something that the application can fetch by understanding the length of transcript, or if you have the audio file, it can go with that as well. And of course, it's not that the doctor is going to give out your entire legal name during the system. So while this can be put manually, patient data can also be pulled using other systems as well. Once this is done, again, this is a kind of long text that basically the main part of this particular text is not the actual interface calling the, say, LLM. That's actually done right here. Invoking the LLM is as easy as defining what the form questions are and what the actual doctor's notes is. Everything else that you saw so far was just the PPT, or in this case, the PDF form being filled correctly. Depending on different PDFs, you might have a few more hassles or less hassles on how exactly you would like to fill in. Again, we have created this particular notebook to take into account any kind of borders, margins, and other facets. Again, all the things that you would like to do for beautification. But hey, at the end of the day, these forms are supposed to be easy to read. So we got the extra step to ensure that can work in that capacity as well. That's exactly what we did. We have pulled in a conversation, and here you will see, if I just scroll up a little, there's an entire conversation that we have pulled in. And in this case, this is anonymized data. That's why we have Miss XYZ, but again, the normal name could also be there. And all the information about this particular patient and doctor has been condensed and automatically filled in with a form. So the way this particular script works, we associate and we add the transcript at the start. The main reason for this was we wanted to make sure that, well, if somebody is looking at the form summary, they have a proof of concept there with that. But again, you can choose to just ignore it. You can directly use this notebook without the transcripts being associated there. And as you see, the application kind of tells us very clearly on what exactly we have done here. At places where it's not exactly sure on what exactly has been filled in, like the knee replacement, it's going to give you a blank check saying that, hey, here's where the end user can come in and fill in specific dates if they have to. And then it's of course going to provide the recommended plans as and when required. This is just one of them. There's another one which I have done earlier, and this also defines exactly what was expected, as in what's the subjective of this particular visit been, what is the objective in this case, what were the levels, what is the results of the examination that the physician has defined has been. As you can see, these have been defined right here as well. And then, of course, what are the potential next steps, that how these particular medications can work in this case for a pregnancy. And the main reason this comes up is that, yes, we have that exact conversation right there. Once we've done this, again, we run the same pipeline for 10 transcripts. These IDs are the IDs for the longest conversations. We're just making sure we're providing the right amount of context. At the end of the day, the application does pick up what exact context is. And if the AI agent understands that, hey, we're working with really little data, this is hardly a 2-minute conversation, I don't have a plan here, I don't have an objective, we've barely done a simple test case here, it's going to fill in only those forms. But as you can imagine, that isn't exactly what we would like to automate here as well, because at that point, even an HCA is not really going to fill the SOAP form in that aspect. And in fact, that's exactly what we would like to do. We'd like to make sure that the form fills in that specific use case itself. So that, in a nutshell, was the demo that we would like to work with. And at this point, I'd like to hand it back to Bu to discuss the final slides, which are on implementation and scalability. Bu,
Thanks,
over to you.
Shubhanshu. Thank you for the great demo. So yeah, now I want to talk about a little bit about the core services in terms of the implementation and scalability for this solution. So that involves SageMaker, Amazon SageMaker, Amazon Bedrock, and AWS HealthLake. So Amazon SageMaker is a fully managed machine learning service that enables you to quickly build, train, and deploy high-quality machine learning models at scale. John Snow Labs, medical LLMs, and the transcription module solution, those endpoints are run on virtual machines managed by Amazon SageMaker. So in terms of scalability for SageMaker, you can configure auto-scaling policies to help you scale up these endpoints up or down as you need. And for Amazon Bedrock is a fully managed service that allows you to fine-tune, build, and deploy your own LLM without the complexities of building and operating the underlying infrastructure. So it also allows you to have access to high-performing foundation models and use a set of APIs to easily access these models and customize language models tailored to specific business needs. And the features within Amazon Bedrock that we kind of want to focus on within this solution involve the use of AI agents and flows. So the use of AI agents offer the ability to configure autonomous agents within your application, and the agent helps your end users complete actions based on organization data and user input. And we can have these agents orchestrate interactions between the foundation models, data sources, software applications, and user conversations. So Shubhanshu gave great examples of how we have to use these agents within this flow to make sure that we're able to fill out the SOAP form properly. And another feature I want to talk about is the flow. This can be used to build the generative AI workflow using a visual builder using nodes. And this is a great way to help us manage this complex generative AI workflow. And lastly, AWS HealthLake acts as the clinical data repository, which is our HIPAA-eligible service, and offers healthcare companies a complete view of individual and patient population health data using FHIR or Fast Health interoperable resources, API-based transactions to securely store and transform their data into queryable format at petabyte scale. And you can also further analyze the data stored within AWS HealthLake using machine learning models. And this is also a fully managed service, meaning AWS takes complete responsibility for managing the underlying infrastructure, including software updates, patching, backups, and other operational tasks. And some of the benefits of using a fully managed service is that it allows you to really focus on your application and core business functions rather than having to spend extra overhead managing the underlying infrastructure. So that's just a little bit about the implementation and scalability. Shubhanshu, if you go to the next slide, please. Yeah, so now we just have some references. So if you want more information on Johnson Labs, feel free to visit their website. And AWS has extensive documentation on Bedrock using AI agents and SageMaker as well. So feel free to check that out as well. Thank you so much for joining this session.
Thank you.